Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, Pennsylvania. This week is going to be our first official blog with content in it, so we're going to dive right in. First week we're going to talk about obviously is chiropractic care. Through the weeks we'll talk about more of our services that we offer, decompression, neuropathy, and then we'll start talking about some of the conditions that we treat as well. So let's dive right into chiropractic. So just a real quick brief history. Chiropractic was introduced in September of 1895 by Dr. D.D. Palmer in Davenport, Iowa, which is where both Dr. Wilkins and I went to school. He actually started the profession by adjusting a patient that was in his building who was partially deaf for 17 years, and after just one adjustment, his hearing was restored, not 100%, but pretty close to it, and thus chiropractic was born. Through the years, his son then took over, B.J. Palmer, and really developed the chiropractic profession even more to what it is today. So before you ask, people ask, are chiropractors doctors? Yes, we are doctors. Now, we're not MDs, we're not PCPs, but we are still doctors. The only difference between us versus a medical doctor is we don't prescribe medicine, we don't prescribe injections, we do everything more of a natural approach, and that's what it is. Now, people will ask, we're more back and neck doctors. Yeah, that's true, we're a back and neck doctor. That's what the patients more so think, but deep down, we already know what we're more so doing. We're nervous system doctors, and we're adjusting the nervous system to help with any functions in the body, movement, sensation, your senses, organ function, stuff like that. And I have my spine to explain what happens here. So here's what chiropractic actually is. The spine is the protective case for the nervous system. Brain sits up here, and then the nervous system runs all the way down. So this is just a protective layer to protect that nervous system so nothing gets damaged. But along the way, what happens is these little bones here called the vertebrae. This is what our job is. Cause rotation. They go up, down, left, or right. And our job is to bring that rotation back to center. Whenever there's rotation somewhere, these yellow pieces right here, they're your nerves. Whenever something's pinched, or like what we like to call them impinged, it causes misfunction in the area here. So in this area, we're in the lower neck, upper thoracic region. There's going to be a lot of neck issues, there's going to be some shoulder issues, and there's even going to start to be some lung issues, breathing issues, heart issues. Now, does that mean that there's going to be something wrong along the way? Yes. If you have multiple rotation, the longer you have it, the more pain that you have. Now, obviously, our job is to get that back out. And does that take one adjustment? No, it does take some time. And it does take us multiple visits, which is why we want to do that treatment plan with you guys. Get the pressure off of that nerve root, and eventually your body will be restored. Now, obviously, the longer you wait, the longer there's going to be issues. And a lot of patients will start to experience muscle weakness, sensation loss, organ dysfunction. So we're more so just doing more than just back and neck pain. We're helping patients with asthma. We're helping patients with digestive problems. We're helping patients go to the bathroom regularly. Those are all problems because they're all controlled by nerves. Nerves control everything in our body. The brain controls everything in our body. Without them, we cannot survive because it runs our heart, it runs our lungs, all and so forth. So now what do we do as chiropractors at our technique? So there's over 200 different techniques in the chiropractic profession. Now, most people are most common with that turning of the neck, turning of the back, cracking, popping. We don't do that here. Do we know how to do it? Yes. But our technique was actually developed in DeRoseburg, Pennsylvania by Dr. Vernon Pierce in the 1960s. He called it the Pierce Results System. And what it is first we want to take x-rays on the patient. X-rays are extremely crucial for our technique because we actually look at the rotation of the pelvis, we look at the rotation of the neck, the spine in general, and it tells us, are we going to adjust left, are we going to adjust right, are we going to adjust straight down, vice versa. So that is the big point of our technique. The other big point is that we use our table to adjust the patient. So pretend my spine is the patient here, and he needs an adjustment in his sacrum, and he needs an adjustment in his pelvis, and he needs an adjustment in his neck. So we use this table right here. It's a drop piece mechanism. Now we find where we need to adjust. So say this patient has rotation in his sacrum here. This is the sacrum bone right here. I find where I need to adjust, and then boom, just like that. No, I didn't hit the table hard enough to get the table drop because I don't want it to drop yet. And then if the patient has a neck concern, same thing. Headpiece comes up just like this. I find where I need to adjust, and then boom, just like this. Now obviously I need to have the right line to drive, but since I'm turning around looking at you guys, I want to make sure that you guys are seeing everything. So this is what the table sounds like. And actually before I do that, after I adjust the patient, I bring this table up. I flip them on their back, and if I need to do a pelvis adjustment, I find where I need to adjust, and the same thing, boom. That is the primary technique that we use here, and that's how we adjust patients. So I'm just going to do a real quick thrust on these tables to make the patients, make you realize what these tables sound like. It's loud, so I want people to realize that it is a little concerning at first, but it is not in any way, shape, or form painful. So I find where I need to adjust, and just like that. That's for the neck. Now low back, same thing. Find where I need to adjust, and I need to drop the table down just a little bit because it's too tight. There's no weight on the table, which is why that table doesn't want to drop. So same thing, find where I need to adjust, and just like that, boom. So, is this the best technique? What we find at our office, yes. It's more safe, it's more effective in what we see. Now, are we saying that all other chiropractic techniques are not effective? No. I have adjusted the other ways, and I do adjust the other ways if I need to. But what we see at this office, we do see really good results. So, that's what I have for you on chiropractic. There's so much more I can talk about, but obviously it could take me days to talk about this stuff. So I'm going to stop the blog here. If you have any questions, please feel free to reach out to us. Give us a call, send us an email, and if you're not on our Facebook, Instagram, or Twitter pages, give us a like. I have more information that goes up on there, and we'll go from there. But next week's blog, I'm going to talk about our decompression service. I'll do the same thing. Monday, I'll do the blog. Wednesday, I'll do the video. So again, if any of you have any questions, please feel free to reach out to me, and I'll be happy to answer any questions. Everybody have a great rest of your week.